Hi everyone, I'm Megan,
Hi, I'm Epiphany.
and we are going to be discussing impacts of a DMD diagnosis on patient and family mental health, especially throughout the pandemic. DMD is not only a physical disease, it also impacts the mental health of patients and their loved ones. Losing muscle tone and being on steroids can lead to mood swings and also to patients feeling like an outcast due to not being able to do what other children can. This gets exacerbated as they enter the early stages of being unable to walk and see themselves as different from their peers. They are unable to participate in activities with their friends, such as going on hikes or going to amusement parks due to their disability, which is even worsened considering they tend to lose ambulation within middle to high school, which is already such an awkward time to begin with. These issues were exacerbated even further during the COVID-19 pandemic, as DMD patients tend to be immunocompromised, especially as they enter later stages where they have heart and lung failure, which means that they may be isolated from their friends and family if they do not live with them, due to the potential risks associated with them contracting the virus, such as potential hospitalization, ICU stays, or even unfortunately death. This also impacts the mental health of their families and close friends, as they are concerned about what will happen if they give their child the virus or if their child contracts it elsewhere. Finally, we will cover the impact of COVID-19 on a patient care, especially within the clinic, as a lot of times we have to move towards telerehabilitation or other Zoom calls in order to not worsen our DMD patient's condition.
Many muscular dystrophy patients are diagnosed when they are only a few years old. This often has an impact on a child's physical, social, and emotional development. In the publication Rare Disease Advisor, writer Jakira Avery talks about her childhood and how it was affected by limb-girdle muscular dystrophy. She was confronted with realities that she wasn't prepared for, that realistically no child could be prepared for. In another article, she talks about the social implications of being in a wheelchair and stereotypes of disabled people that she continues to face as an adult. This category of patient perspectives, published on Rare Disease Advisor, gives a glimpse of the various emotions that come along with disease diagnosis. In her article, Treat Your Mental Health Before It Becomes Too Much to Bear, Leah Leilani describes her battle with depression and anxiety while also managing muscular dystrophy due to mitochondrial dysfunction. She talked about how she felt like a burden to her family and the difficulty of finding proper treatment. I would imagine that many children who are diagnosed with various muscular dystrophies feel a way similar to Leah Leilani and Jakira Avery. Children are forced to grow up and mature very quickly because of their disease, and they don't have what other people would call a normal childhood. This can be isolating because their life is different from the people around them in many ways, especially as a child. Muscular dystrophies come along with various physical limitations and phenotypic manifestations. According to Colvin et al., quote, in recent studies of patients with DMD, approximately 32% of patients had attention deficit hyperactivity disorder, 26% had learning difficulties, 17 to 27% had an intellectual disability, 27% had anxiety, and 15% had autism spectrum disorder.
As you can see, mental health is extremely affected in patients with muscular dystrophies, but it has been even worsened over the course of the COVID-19 pandemic. In a survey conducted by Muscular Dystrophy UK, 62% of respondents said that the pandemic had a negative effect on their mental health. The social isolation associated with quarantine can act as a catalyst of many mental health problems, including stress disorders, insomnia, emotional stress, and mood disorders, to name a few. The prolonged distance associated with the elevated level of stress can induce depressive episodes, panic, and anxiety, which appears to have a higher effect on people affected by muscular dystrophies and for their families. This also leads to an effect on a patient's physical health with their disease. In a survey conducted by Parent Project Muscular Dystrophy, 22% of respondents said that their child's condition had worsened during the pandemic. This is due in part to a decline in mental health from being unable to see family and friends, the odds of potentially missing doctor's appointments, or even a lack of physical activity due to being unable to attend physical therapy or participate in other therapy treatments, such as going for a swim. Alan Heber, a DMD community contributor to Rare Disease Advisor, has shared his experience with the pandemic. He discussed his experience prior to getting vaccinated with the anxiety associated with his mother potentially bringing COVID home from her job or his dad contracting it at the grocery store. Since DMD has a hallmark symptom of reduced lung function and COVID tends to attack the lungs, he made the decision to enter heavy quarantine to reduce his risk of contracting the virus. In a quote from his article, Heber stated, quote, "I not only faced boredom, but also loneliness from losing my in-person social life. As all this flooded my thoughts, it was easy to get depressed and hopeless," end quote. Over the past 2 years, Heber has celebrated every major life goal in quarantine, including losing a chance to have a friend over for his birthday due to his friend contracting the virus and not wanting to pass it on to Heber. He states, quote, "Sheltering at home so much has taken a swing at my sanity," end quote. One of the major concerns him and a lot of other DMD patients have is that the fluctuation between hope that we're almost through this pandemic and panic once a new variant arises is tiring, which is the last thing they need as it will deteriorate their health.
Not only does muscular dystrophy affect the person diagnosed, it can also affect their parents and other family members. The diagnosis of a child is extremely difficult for parents, especially for rare diseases like Duchenne muscular dystrophy. Their lifestyle changes significantly, becoming filled with doctor's appointments, clinical trials, research studies, and medications. In an article for PsychReg, Father Kieran Sales talks about the powerlessness that he felt when faced with the diagnosis of his son. At the same time, they were undergoing other major transitions as a family, specifically moving. He talks about experiencing symptoms of depression and excessive worrying. He described the lack of access to mental health care, which became even more difficult with the COVID-19 pandemic. I would imagine when caring for a son with DMD, there isn't as much time to care for yourself, given that children's health is the main priority. Looking from a mother's perspective, in her blog, Georgina shares her family's experiences and the financial, social, and emotional devastation caused by COVID-19. She feels bad for her son because he is spending his good years stuck in quarantine, and he may be in the non-ambulatory stage after the pandemic. This is not how she imagined spending these years of ambulation, and the severity of DMD disease progression is daunting. It's difficult for her to see both the physical and mental deterioration of her son Connor without access to outside treatments, his friends, and other extended family. Though everyone is focused on minimizing the spread of COVID currently, her family has to be extra cautious because her son's health cannot be compromised. People with disabilities have had to quarantine longer than everyone else and possibly may not be able to get vaccinated. An already stressful pandemic becomes intensified for families who have a family member diagnosed with muscular dystrophy. In a study conducted by Landfeld et al., the researchers obtained self-reported data regarding the mental state of primary caregivers of children with DMD and their assessment of the perceived mental health of the patients. In Figure 1, Part A, we see that 40 to 50% of caregivers feel anxious or depressed to some extent, regardless of the stage of disease progression. The reference dashed line shows these percentages are about double the normal incidence of other similarly aged adults. Part B shows that this increases to about 70% when the patient is in fair/poor health. The degree of depression/anxiety also increases if they believe that their son is very unhappy. In Figure 3, we can see the various facets of a caregiver's life that the disease can impact. Over 90% of the caregivers who were interviewed said that they were fearful or stressed at some point. There are also social and economic concerns that were expressed by some caregivers, looking at categories such as feel that they don't have enough money to take care of the relative. And there's another category that also says that feels that social life has suffered because they're caring for the relative. And this study exhibits that family members are experiencing a mental impact due to their proximity to DMD, and they see it impacting the boys with Duchenne in a tangible way as well.
As the pandemic hit, many patients had to adjust their plans in terms of medical care. Due to patients' needs for social distancing, due to their immunocompromised condition, appointments and medical testing had to be adjusted to be remote if clinically possible. In the Parent Project Muscular Dystrophy survey, 78% of patients had either virtual appointments or missed appointments entirely, and 46% of the surveyed patients had a combination of in-person and virtual appointments. Many patients missed out on having face-to-face appointments with their providers, which may harm their treatment. Also, 47% of patients in the survey missed at least some medical tests, which is a cause for concern as Duchenne patients should be monitored regularly to check their levels and assess their current condition. Like I mentioned earlier, these factors led to 22% of parents surveyed stating that their child's muscular dystrophy worsened throughout the pandemic. If the patient does unfortunately contract COVID-19, their medical treatment should be continued and a stress dose of corticosteroids may be prescribed if deemed necessary by their physician. Also, if the patient cannot keep medication down, it is recommended that they have someone who may be able to give an intramuscular steroid injection to avoid stopping treatment, which can have really harmful effects on their health. In addition, telerehabilitation programs, including online physical therapy sessions or mental health therapy sessions, should be scheduled if they are unable to go in person. Telerehabilitation can be done either synchronously through Zoom or through video sent to the patient, be done at any time they can so as to not worsen their physical or mental condition.
This course has placed great importance on multidisciplinary care for patients, and a major component of this is mental well-being. It's important to consider how muscular dystrophy affects patients and their families. Though mental health within the muscular dystrophy community has been heavily studied, the ongoing global pandemic is bound to impact the experience of an already vulnerable population. Through these firsthand accounts, we can see the additional stressors that patients and families experience through the pandemic. We may see the implications of COVID, such as higher depression and anxiety rates in future studies of Duchenne and other muscular dystrophies. Therefore, it is important to look at mental health in the context of the COVID-19 pandemic. Thank you so much for listening.